جامعة الأزهر، وطبعا الدكتور هاني حماد نفرولوجيست بتاعنا بتاع الاي سي دي، فأنا سعيد طبعا بوجود المجموعة الرائعة دي. أنا هتكلم على السيفتي اند فاستنج during Ramadan in people with diabetic neuropathy and cerbrovascular disease. هو الحقيقة هنا الايفيدنس أو الساينتفك ايفيدنس للكونديشنز دي كان فيو ايفيدنس، ما كانش في رمضان، كان فيو ايفيدنس. فاحنا يمكن اعتمدنا اكتر على الفاكس اللي احنا عارفينها في السيربروفاسكولار ديزيز والريكارنس اوف سيربروفاسكولار ديزيز في النيوروباثي وايه اللي بيزود النيوروباثي. فالحقيقه كان لكن المشكله بتاعتنا كان هنا الايفيدنس هنا كان مش كتير. مش بيعديني. ممكن حد من بيرو سبوت؟ مش بيعدي. طيب في الأول هبدأ برمضان فاستنج in people with diabetes and cerebrovascular disease. Diabetes is an independent risk factor for ischemic stroke and recurrent stroke. دي فاكت كلنا عارفينها، وإن بنقول إن حوالي 30% of patients with ischemic stroke have diabetes. recurrent stroke كمان بتحصل في حوالي 18% of people with diabetes after previous ischemic stroke أو TIA. في ميتا أناليسيز من 27 studies فيها حوالي أكثر من 400,000 patients. The risk of recurrent ischemic or lacunar strokes in patients with diabetes was 1.5 times and 1.6 times higher than in those without diabetes respectively. يعني patients اللي جالهم recurrent stroke قبل كده معرضين يجالهم recurrent stroke مرة تانية ب 1.5 times risk. البيشنتس اللي جالهم lacunar stroke معرضين ب 1.6 times higher risk than patients without diabetes. The impact of Ramadan fasting on the risk of CVS in people with diabetes is debatable and has been addressed only in few studies. دي كانت مشكلة، عشان كده زي ما قلت خدنا الإيفيدنس بطريقة indirect من الويل نون فاكس اللي احنا عارفينها عن الستروك والأثيروسكليروزس. The Egyptian study found that fasting during Ramadan was not associated with increased frequency of hospitalization for cerebrovascular stroke as a whole. يعني لو قلنا ان في قبل رمضان حوالي 30 حاله بيدخل المستشفى، هم برضه 30 حاله في رمضان ما بيزيدوش، لكن هنا اللي لقوه هنا غريب. The proportion of patients with ischemic stroke relative to hemorrhagic stroke كان اكتر. يبقى however there is increase the proportion of ischemic stroke to relative hemorrhagic stroke. Other studies found increased risk of ischemic stroke during Ramadan fasting in people with diabetes. one study كانت في أربيل في العراق، فكان رمضان وقتها كان سنة 2012 وكان رمضان في شهر أغسطس. وكانت الستادي دي in middle and old age patients. among them كان 22 كانوا هم 60 عيان وفيهم 22 patient عنده diabetes. Fasting during Ramadan was found to be an independent risk factor for ischemic stroke, which was attributed to hot weather and long fasting hours. In other study, people with diabetes had higher frequency of ischemic stroke during Ramadan than periods before and after Ramadan. زي ما حضراتكم شايفين هنا في التيبل الصف الاولاني الريسك كان في رمضان اعلى من قبل رمضان واعلى من بعد رمضان. وهنا الاوثرز attributed the high risk for ischemic stroke in Ramadan to increased hyperglycemia. وهنا الهايبرجلايسيميا كانت سببها او يعني تفسير الاوثرز هنا كان dietary indiscretion and excessive gorging during non-fasting hours. و decreased physical activity و stopping treatment و dehydration مع long fasting hours and hot weather countries. عشان كده أهمية الإديوكيشن زي ما الدكتور هشام قال، أهمية إن العيان هياخد التريتمنت بتاعه وهيبقى موديفايد العلاج بتاعه وهياخد إديوكيشن عن الدايت والأكتيفيتي في شهر رمضان من قبل رمضان. In many studies in patients with previous ischemic stroke or TIA, among them 18% with diabetes, there is higher risk of stroke recurrence or subsequent stroke than patients without previous stroke or TIA. يبقى البيشنتس اللي عندهم جالهم ستروك قبل كده أو جالهم TIA قبل كده معرضين أكتر إن جالهم ستروك. الاسكيميك ستروك بتحصل افتر تي اي اي في حوالي 22% within 7 days، يعني حوالي خمس من البيشنتس بتجيلهم ستروك في خلال اسبوع من التي اي اي، و6% في خلال سنه، و up to 9% within 5 years. ولقوا ان حوالي يعني نص حالات الستروك occurred after 12 months from previous index TIA. So we can conclude that several factors such as weather differences, number of fasting hours, degree of glycemic control, age, duration of diabetes may contribute to this discrepancy in studies addressing ischemic stroke risk in Ramadan in people with diabetes. All these factors, in addition to other risk factors for stroke, hypertension, dyslipidemia, other factors should be considered in the risk stratification. Cat recommendations of ACD group: people with diabetes and thrombotic CVS or TIA within 6 months before Ramadan. يمكن ده الكلام نفسه اللي قلناه او اللي اتكتب في الحالات بتاعت الافتر acute coronary syndrome او after chronic stent. People with diabetes and thrombotic CVS or TIA within 6 months before Ramadan are considered very high risk group، يعني must not fast during Ramadan. People with diabetes with history of cerebrovascular events more than 6 months duration are considered a high risk group and should not fast during Ramadan. زي ما بنقول if they insist on fasting لازم ده يبقى under strict control education لكل الكارديوفاسكولار ريسك فاكتورز والفاستنج during رمضان. بعد كده هتكلم على الدايابيتك نيوروباثي. يمكن الدراسات دي ظهرت بعد ظهور الكونتينوس جلوكوز مونيتورنج واهميته والادفانتج بتاعته اوفر الاي 1 سي استيميشن. لقوا البلاد جلوكوز فاريابيليتي is a significant risk factor contributing for developing and deterioration of diabetic peripheral neuropathy and diabetic autonomic neuropathy. In people with diabetes, diabetic autonomic neuropathy is associated with increased risk of cardiovascular mortality and silent myocardial ischemia. In one study in Egypt، يعني زي ما بقول الدراسات دي قليله جدا. In one study in Egypt, it was found that after fasting Ramadan, there was a significant improvement of beta cell function and some improvement in diabetic retinopathy، لكن كان في increased album creatine ratio بعد رمضان و deterioration in nerve conduction velocity. وبالتالي recommendations بتاعنا patients with advanced peripheral neuropathy and autonomic neuropathy are in high risk group and should not fast during Ramadan. Thank you. معلش هي short talk لأن evidence هنا عندنا كان زي ما بقول قليل قوي.
شكرا دكتور عمرو بيه، كالعاده بريسايز تو ذا بوينت. والحقيقه طبعا زي ما دكتور عمرو بيه تفضل وقال انه الايفيدنس كان فيري سكانتي، وبالتالي الكونسنسس اتبنى على الداتا اللي كان دكتور عمرو بيه تفضل بيها. هو الحقيقه انا مع حضرتك في انه الناس اللي بتحاول تصوم عيانين عندهم cerebrovascular stroke recent او حتى old دول مش حاطين في الاعتبار قد ايه الريسك اوف ريكارنس اوف ستروك. وعشان كده فعلا انا برضو بطرح لو في اي حد عنده اي تساؤل عن النقطه دي. والدكتور عمرو قالها صريحه، عيان جاله ستروك within 6 months او حتى اكتر من 6 months، العيانين دولا يفضل وينصح ان هم ما يصوموش. حته النيوروباثي طبعا حضرتك عارف ان وحضرتك تفضلت وقلت النيوروباثي ده ريسك فاكتور لحاجات تانية، يعني اللي عنده نيوروباثي هيبقى عنده نفروباثي، هيبقى عنده ريتينوباثي، وبالتالي الريسك هتبقى عاليه جدا في حاله صيامهم. Our next speaker is the boss بروفيسور ايناس شلتوت، هتتكلم معانا عن الريسك ستراتيفيكيشن في عيانين الفاستنج رمضان في البريجننسي واللاكتيشن والالدرلي. الحقيقه دكتوره ايناس كانت صارمه جدا اثناء واحنا بنصوغ الكونسنسس، لانه بصراحه الداتا اللي كانت اتقالت والناس اللي كانوا عاوزين يصوموا ستات حوامل دايابيتك او لاكتيشن، كان دكتوره ايناس كانت صريحه جدا وصارمه جدا. دكتوره ايناس اتفضلي يا فندم.
يعني خليني اقول ان انا لما لقيت بعض الكونسنسس والجايد لاينز بتصوم الحوامل، وانا كنت مشاركه معاهم، بس انا قعدت فتره مش بنام، كنت حاسه ان انا ممكن اكون متسببه ان انا بموت ناس، بموت امهات او بموت اجنه او مش بموت ممكن طفل يطلع بعد كده منتال ريتاردد مثلا في المستقبل، ما نعرفش، محدش عمل لونج تيرم داتا. عشان دي مشكله ان ستاديز اغلبها بيقولوا احنا صومناهم رمضان وصاموا بامان. طيب ما بعد رمضان حصل ايه؟ حتى مش بيشوفوا الولاده، الاوتكم بتاع الولاده شكله ايه، ما بيشوفوش الطفل ده بعد 5 سنين لما يجي يدخل مدرسه المنتال كاباسيتي بتاعته شكلها ايه. فده اللي كان عامل لي طبعا قلق. عشان كده زي ما الدكتور هاني بيقول انا كنت شويه ستريكت في موضوع الحوامل، خصوصا ان ربنا ادى رخصه للحامل انها تفطر، وان كمان ممكن واحده تبقى حامل نون دايابيتك ويجي لها هايبوجلايسيميا. يعني ده بقى اللي احنا لازم نعرفه، ان ممكن واحده حامل نون دايابيتك بس عشان فتره الانقطاع عن الاكل بيحصل لها هايبوجلايسيميا، فما حال لو كانت دايابيتك وبتاخد انسولين، لان الانسولين هو التريتمنت فور دايابيتس ويز بريجنسي. اسفه للمقدمه الطويله، لكن دكتور هاني دفعني ان انا اتكلم عليها. اتكلم على ASD consensus pregnancy lactation and old age, and let me give my presentation in the form of cases. And let me start with this case scenario. Fasting of a pregnant diabetic patient, Mrs. Mona, 28 years old, type 1, since 4 years. Now she's pregnant in her 3rd month and wish to fast next Ramadan. Another case scenario, Mrs. Noha, 36 years old, discovered to have gestational diabetes during her 5th months of pregnancy, and she wished to fast next Ramadan. This is the glycemic targets during pregnancy according to ASD and AGA guidelines. And for preprandial blood glucose level in patients with gestational diabetes, the blood glucose should be less than 95 milligram per deciliter, very strict control. And for patients with pre-existing type 1 diabetes or type 2 diabetes, the pre-meal, bedtime, and overnight blood glucose should be between 60 and 99. Very strict blood glucose control, and alarming to high incidence of hypoglycemia in those patients. For postprandial and post-meal, in patients with gestational diabetes, 1 hour post-meal should be less than 140, and 2 hours post-meal should be less than 120. For peak postprandial glucose between 100 and 129 milligram per deciliter in those with pre-existing type 1 or type 2 diabetes. Then we should go for strict diabetes control, whether in patients with gestational diabetes or with diabetes with pregnancy in type 1 or type 2 patients. And hemoglobin A1C should be less or equal to 6%. This is written in the table. Pregnancy itself may be associated with impaired counter-regulation system and hypoglycemia unawareness. Then this is the first hazard is loss of counter-regulation and hypoglycemia unawareness. The risk of hypoglycemia in diabetic patients is due to high insulin concentration and failure in the physiological protective mechanism. Around 45 to 71% of type 1 diabetic patients experienced severe hypoglycemia during pregnancy. These are all studies. Severe hypoglycemia can occur during pregnancy 3 to 5 times more frequently in the first trimester and at a lower rate in the third trimester. The effect of hypoglycemia on the fetus is controversial. Possible role in teratogenicity is still debatable. Low level of maternal glucose during pregnancy may cause fetal growth retardation and small for date infants. In addition, maternal hypoglycemia may also determine impaired fetal beta cell function, and later on these children may have diabetes in the future. Another group of problems in pregnancy, placental insufficiency in the third trimester with unwarranted hypoglycemia, diabetic ketoacidosis may be fatal to the fetus, neonatal hypoglycemia, very high incidence rate of severe hypoglycemia, between 19 and 45% have been reported in diabetic pregnancy. All of these have references. And a 2008 study of pregnant women with type 1 patients found 45% of the patients experienced episodes of hypoglycemia. The decreased blood glucose level in pregnant women may affect fetal outcomes. For example, it may cause fetal growth retardation, small for gestational age, and impaired fetal beta cell function. Hazardous effect of recurrent hypoglycemia on the adult brain is well known. However, there is no available data on long-term effect of recurrent hypoglycemia on fetal brain health. Therefore, we cannot guarantee the safety of maternal fasting during Ramadan on long-term fetal brain health. Mergani and Hamoud found a higher rate of induction of labor, cesarean section, and admission to special care units of the newborn in the fasted group compared with the control group. Diabetes or gestational diabetes during pregnancy increase the risk of unfavorable maternal and fetal outcomes. Therefore, women with diabetes who become pregnant are instructed to avoid Ramadan fasting. What about fasting for lactating ladies? For breastfeeding, data suggests that women with diabetes may experience hypoglycemic event during lactation. Therefore, they are advised to eat. This is an advice for safer fasting, to eat before or during breastfeeding to avoid hypoglycemia. If the lady is lactating, so we can give her a meal before or during lactation. Achieving desired metabolic control in fasting lactating women during Ramadan is challenging. It's not easy. This is the summary of recommendation of ASD Consensus 2024. A pregnant lady with diabetes, whether type 1, type 2, or gestational diabetes, are considered very high risk group and must not fast during Ramadan. Lactating women with diabetes who are not taking insulin are considered moderate risk and may fast during Ramadan with medical supervision. Lactating women with diabetes on insulin therapy are considered very high risk and must not fast during Ramadan. This is the second case scenario, diabetes in geriatric times, and the risk of hypoglycemia, which may lead to impaired cognition, is increased in the elderly, and the manifestations are mainly neuroglycopenic, like dizziness, weakness, delirium, and confusion. These symptoms may be missed or may be confused as primary neurological deficit, like transient ischemic attack, leading to inappropriate management. Severe hypoglycemia accounts for 17% of all hospitalizations of type 2 diabetes in the elderly. Age per se should not be a barrier for a safe fasting during Ramadan. Comorbidities, complications, type of anti-diabetic medication, and the presence of hypoglycemia or hypoglycemia unawareness will remain the main concern. The presence of CVG and impaired renal function could compromise the safety of fasting in elderly with long-standing diabetes, making their glycemic control challenging. This is a case scenario: a 69 years old female housewife, diabetic type 2 since 7 years. She's on DPP-4 inhibitor and metformin, so she's receiving safe medications for fasting. She's hypertensive on ACE inhibitor plus amlodipine. She's also on clopidogrel. And Professor Atif, I think, was talking about the anticoagulation during Ramadan and the difficulty of maintaining the action of anticoagulation during fasting. This patient is taking clopidogrel aspirin combination for recurrent transient ischemic attack. So this patient is also having another cardiovascular disease or neurological deficit, TIA. This last attack was 9 months ago. Then there is no fear for the TIA because it exceeded 6 months. She has no evidence of other cardiovascular disease affection, and her hemoglobin A1C is 7.4. She's not very well controlled, but not above 10, and we avoid fasting for those above 10 hemoglobin A1C. She has advanced retinopathy, and we're going to hear the presentation of Professor Layla Hamouda soon in her left eye, which she received laser treatment. Her blood pressure is 150/90, a little bit not controlled, need to readjust her blood pressure medications, and the examination is unremarkable apart from mild edema of the lower limbs. She's hypothyroid, and as she undergone thyroidectomy 5 years ago for multinodular goiter, her TSH on 100 microgram is 9. So she's not well controlled, and we had data maybe Professor Elmiligi will give us his opinion about uncontrolled hypothyroidism during fasting. She's on a statin for dyslipidemia. She has evidence of macroalbuminuria, although her GFR is 61, and we will have soon session on the presence of CKG in people with diabetes who wish to fast Ramadan. So this patient, can she fast or not? This remains a question with the multiple comorbidities in the patient. Advances in medical care and improved social conditions increase life expectancy, and the epidemic of diabetes will involve older individuals. According to IGF Atlas, 1 in 5 people with diabetes is above 65 years old, and diabetes in old age is a risk factor for dementia, falls, hip fracture, CVD, amputation, and visual impairment. Elderly people with diabetes have increased risk of volume depletion. So maybe SGLT2 inhibitors are not convenient with elderly patients. Thus, fasting during Ramadan in this group may affect their postural balance and attention, which may increase the risk of falls or fall-related injuries. بسم الله الرحمن الرحيم. شهر رمضان الذي أنزل فيه القرآن إلى جزء من الآية الكريمة يريد الله بكم اليسر ولا يريد بكم العسر. الإسلام سمح. بسم الله الرحمن الرحيم. ولا تقتلوا أنفسكم إن الله كان بكم رحيما. This is a study done by ASCD. Proved that 98% of people with type 2 diabetes intend to fast during Ramadan. So fasting is very popular in Egyptian people with diabetes. Most of them wish to fast, 98%. And this is the DAR study, DAR diabetes survey. And this was a question to the patient: did you break your fast because of diabetes-related illnesses? And 79% of the patients said, no, we're not going to break the fast with diabetes-related illness. This is very serious. This was in Egypt, by the way. 79% of Egyptians did not break the fast due to diabetes-related illness. When we compare with Turkey, the Turkish figure was also 88% of cases said, no, we're not going to break the fast. Another question: did you have to break your fast during this Ramadan because of hypoglycemia? And 35% of the patients said, no, I did not have to break my fast due to hypoglycemia. Again, very serious. Then we should go for pre-Ramadan education. And this was our study: culturally based pre-Ramadan education, increased benefit and reduced hazards of Ramadan fasting for type 2 diabetes patients. Pre-Ramadan education could improve the patient awareness about hypoglycemia and also how to manage hypoglycemia during Ramadan. This is the DAR global survey again during COVID-19 pandemic and the impact of older age on fasting among adults with type 2 diabetes. And this is the incidence of hypoglycemia for older population during Ramadan. And we can find the maximum hypoglycemia happened just before Maghrib, before Iftar. 54% and 64% happened between 3 p.m. and Maghrib. This is a summary of recommendation for older age. Frail older people are categorized as very high risk and must not fast during Ramadan. People with dementia and cognitive disorders are among very high risk groups and must not fast during Ramadan. Older people with poor health or associated comorbid conditions are categorized as high risk group and should not fast during Ramadan. Older people living alone on insulin or older generations of sulfonylurea are categorized as high risk group and should not fast during Ramadan. Older people above 75 years and not having any other comorbidity are categorized as moderate risk and can fast with caution. A pre-Ramadan focused diabetes education on safe fasting should be done and when to break the fast in conditions of hypoglycemia, hyperglycemia, dehydration, and to improve hypoglycemia awareness. Stress on home blood glucose monitoring. You're going to fast, then you will have to make SMBG. Good hydration, especially in summer with longer fasting Ramadan. GPP4 inhibitors should be used over sulfonylurea as a second-line therapy after metformin, so they are more preferred than sulfonylureas. When using sulfonylureas, glycoside MR and glimepiride should be used instead of glipenclamide. Metiglenide may be used instead of glypuride. Basal insulin analogs may be used instead of NBH, though these are used for safer fasting in the elderly. This is our table of recommendation for those who are very high risk, pregnant ladies with diabetes, whether type 1 or type 2, or gestational diabetes, lactating women on insulin, for older age, frail older people, elderly with cognitive disorder and dementia, for high risk, older people with poor health or having associated comorbid conditions, the moderate risk, lactating women with no insulin intake, and older people, even if above 75, who have no any other comorbidity, are considered a moderate risk, so they can fast with medical supervision. Thank you very much.